Well, welcome to this talk. My name's John Campbell, and I'm going to be talking you through some of the prefixes we use in medical terminology in this presentation. Heme means to do with the blood. So H-A-E-M is the traditional English spelling, H-E-M is the American spelling, the US spelling. Doesn't make any difference, both mean blood. So hematuria, prefix heme, suffix urea, that is blood in the urine, bleeding into the urine. Hematemesis, now emesis means vomiting. So hematemesis is blood in the vomit. So this can be frank blood that looks like obvious, fairly fresh blood, or it can be altered blood. Because if people bleed into the stomach, then the blood is partly digested, if it's there for a period of time. And then when it's vomited out, it looks like coffee grounds. We call this coffee ground vomit. So suspect frank blood and suspect coffee ground appearance as being hematemesis. Hemoptysis is the coughing up of blood from the respiratory tract. Typically that blood is reddish, fairly bright red and often frothy because it's mixed with sputum. And of course, the cause of all these things need to be explained. These are all serious clinical signs that can represent significant pathology that need to be explained. So we have hematology, and hematology is the study of blood. So a hematologist is someone who studies blood and blood diseases. Now, hemangioma, the heme bit on the front is blood. Angio, in the middle, the root there, is to do with blood vessels. And oma, O-M-A, means a lump. So a hemangioma is a collection of blood vessels that forms a lump under the skin. Oma means a lump. Sometimes these are called strawberry marks because the surface looks a bit like the surface of a strawberry. Usually they're a bit raised, a bit red, and they might feel warm because of there's more blood near the surface of the body. But remember the components of the word. Heme is the prefix. Angio, blood vessels, oma, lump, in. So it's literally blood, vessel, lump, hemangioma. Hemi, H-E-M-I, means half. So the Earth has a northern hemisphere and it has a southern hemisphere, half spheres. Hemiplegia. Now, plegia means paralysis. Now, you probably know it's the right side of the brain that controls the left side of the body. And it's the left side of the brain that controls the right side of the body. So if there's a severe stroke that affects the right side of the brain, that can paralyse the left side of the body, going all the way down the middle, down the symmetry line of the body. And plegia is paralysis. So hemiplegia would mean half of the body is paralysed. But alternatively, the body might not be paralysed, it might just be weaker on one side. So that would be a hemiparesis. So plegia means paralysis, paresis means weakness. Or there might be a root in the middle of a word with hemi at the front. Hemicolectomy. So hemi means half, col means colon, ectomy means surgical removal of. So a hemicolectomy would be a surgical removal of half of the colon, a hemicolectomy. Now hepatic or hepato is to do with the liver. So hepatocyte is a liver cell. Hepato is the prefix, liver, cyte is cell. So the individual functional liver cells are the hepatocytes. Hepatitis, I-T-I-S, on the end is inflammation of. So hepatitis is inflammation of the liver for whatever cause. For example, it could be a viral infection causing hepatitis. Hepatomegaly. So prefix hepato, we know it's to do with the liver. Megaly means big or enlarged. So hepatomegaly would be an enlarged liver. For example, if someone's been drinking too much alcohol, the liver cells can fill up with fat, giving rise to an enlarged liver, a hepatomegaly. Or hepatocellular carcinoma. Hepatocellular is a primary tumour that begins in the hepatocytes. So unfortunately, it's relatively common to get malignancy in the liver as metastatic spread from the gastrointestinal tract. But a hepatocellular carcinoma is one which is a primary starting in the liver, where the malignancy starts in the hepatocytes themselves. Hepatocellular carcinoma. Hyper means too high, hypo means too low, but we've actually dealt with these in some detail earlier on in this presentation. Laparo as a prefix means to do with the abdomen. So laparotomy, otomy means a surgical opening into. So laparotomy would be opening the abdomen. Laparoscopy would be looking into the abdomen, perhaps using a surgical fibre optic device to look into the abdomen, laparoscopy. Lith or litho means a stone. So lithiasis is where there are stones present, and of course these are completely pathological. So you might be sent for a lithotripsy. Tripsy means to crush or to break up or pulverise. It's Greek. So lithotripsy would be a crushing of a stone. Urolithiasis would be, uro is the urinary tract, lith is the stone, asis is condition of. So urolithiasis is when there is a condition of stones in the urinary tract. Of course, a pathological situation. Cholelithiasis is where the stones related to the biliary system. So in cholelithiasis, stones can develop inside the gallbladder. They don't do too much damage in the gallbladder, but when they pass out into the cystic duct and the common bile duct, they certainly can cause severe pain, biliary colic. But look at the word chole, bile, lith, stone, asis, condition of, stones from the gallbladder, or stones generated in the gallbladder, present in the gallbladder or present in the bile ducts, cholelithiasis. Now, in surgery, you might have come across a very undignified position called the lithotomy position. This is where the legs are put in stirrups and held up and apart, lithotomy. And this goes back to the very early days of surgery, where people were put into this lithotomy position to remove bladder stones. And the position is just stuck, it's a lithotomy position. Lipo or lipid means fat, so a fat is a lipid. So lipemic would mean fat in the blood. Dyslipidemia would mean an abnormal profile of fats in the blood. So dys is abnormal or painful, in this case abnormal. Lipid is fat and emia is in the blood. So what you're supposed to have is a certain amount of high density lipoprotein and a certain amount of low density lipoprotein. The high density lipoprotein is protective against arterial disease, against atherosclerosis, whereas the low density lipoprotein is atherogenic, it will cause the condition. So if someone is dyslipidemic, if they have a high level of low density lipoprotein and or a low level of high density lipoprotein, predisposing them towards the development of atheroma. So they would be dyslipidemic. And we would need to treat that with lifestyle and probably with statins. Lipoma is a fatty lump. So these can often occur under the skin, for example. They're benign, but they form a fatty lump. And we can tell they're benign because they're soft and because they move freely between finger and thumb. And when we send samples to the histologists, they'll tell us that they are benign. But they're often removed because they're inconvenient or cosmetically unsatisfactory. Lipoma. So lip, fat, oma, lump, lipoma. Mal is another very common prefix, meaning abnormal. So malfunction means that the function is not normal. Malabsorption means that the absorption is not normal, very often referring to the absorption of nutrients from the gastrointestinal tract. into the blood and lymphatic system. If there's not normal absorption, there can be malabsorption syndromes. Malnutrition means abnormal nutrition. If someone doesn't get enough of some nutrients, they will be malnourished. Or indeed, if someone takes too many of some nutrients, particularly energy-containing nutrients such as fats and carbohydrates, they'll become obese. That's because they've got too much of a dietary component. They are malnourished. So malnutrition can mean too much or not enough of a nutrient. Malunion, that's a term often used in orthopedics where the bones don't heal together properly. There's a malunion of a fracture, or the fracture is healing in an abnormal position. Just means an abnormal union of bones. Mast is to do with the breast. So, mastectomy would be surgical removal of a breast. Mastitis is inflammation of a breast. Very often mastitis can occur as a complication of breastfeeding where there's bacterial infection in a breast, but does tend to respond very well to antibiotics, but a painful condition. Mastalgia, algia is pain, so mastalgia would be pain in a breast. And gynecomastia, we normally use this term to describe breast development in men. So when men develop breasts, we call that gynecomastia. For example, men that drink a lot of alcohol can develop gynecomastia, and it can also be a side effect of some medications or a feature of obesity. Myo is the prefix indicating muscle. So the myocardium is the muscle of the heart. So myocarditis would be inflammation of the muscle of the heart, as for example might be caused by a viral infection causing viral myocarditis. Myopathy is disease in a muscle. Myo, muscle, pathy, disease of myopathy. Myoma, oma means a lump. So a myoma would be a benign lump in a muscle, as opposed to a myosarcoma, which would be a malignant lump in a muscle. Rhabdomyolysis. Right, the myo part, you know that means muscle. Lysis means to break up. And the rhabdo there actually means rod-shaped or straight. So this is breakup of the skeletal muscles. There can be a rhabdomyolysis. The problem with rhabdomyolysis is it will release free hemoglobin into the blood, and that can clog up in the glomeruli, causing an acute renal failure. Rhabdomyolysis. Neph or nephro means to do with the kidneys. So a nephrologist is someone who studies the kidneys and kidney diseases. Nephrotic Syndrome. Nephrotic is where the glomeruli in the kidneys become leaky and can leak protein into the urine, causing a proteinuria. This can diminish the amount of protein in the blood and potentially lead to edema, nephrotic syndrome. Nephritis, itis is inflammation of the kidneys. Pyelonephritis, the pylo part relates to the renal pelvis. The neph part is the kidney. The itis is inflammation of. So pyelonephritis means inflammation of the renal pelvis, the renal parenchyma, the renal tissue itself, inflammation of. And it's usually caused by bacterial infection, and a very serious condition it is or can be. Nephrotoxic means that something is toxic to the kidneys. So quite a few toxins can be nephrotoxic. And we have to be careful with some antibiotics, gentamicin for example. If we give too much gentamicin, that will be nephrotoxic. So we have to monitor the gentamicin levels to make sure we're not in the nephrotoxic range, we're not damaging the patient's kidneys. Hydronephrosis. Hydro is water, actually means urine. Well, it literally means water, but in practice it's urine. Neph is the kidneys and osis is condition of. So hydronephrosis is where the urine dams back up into the kidneys, and the hydronephrosis, when the kidneys are waterlogged with urine over time, will cause renal failure. Oligo means few or not enough. So oliguria would be low volumes of urine. Oligospermia would mean that there's not enough sperm in the seminal fluid, meaning conception is less likely to occur. Oligohydrosis is a deficiency in the amount of amniotic fluid surrounding the fetus, potentially giving rise to congenital birth defects and sometimes what we call a Potter syndrome. Peri means about or around or surrounding. So pericarditis, well, the pericardium is the layer around the heart. So pericarditis would be inflammation of that pericardial layer. Perinatal is the time around about birth, just before, during and just after birth. And we sometimes talk about perioperative care, the care of the patient before surgery, during surgery, and in the post-operative period, perioperative. Prost means to do with the prostate gland. So prostatitis would be inflammation of the prostate gland, causing pain in the perineal area between the legs and sometimes causing blood in the seminal fluid, so-called hematospermia. Prostatism would just be an abnormal condition of the prostate gland. So very often as men age, they get benign prostatic hyperplasia, giving rise to lower urinary tract symptoms. But of course prostate cancer can develop as well and is perhaps, in fact, is the most common cancer diagnosed overall in men. Fortunately, prostate cancer affects older men rather than young men. Prostatectomy, well, we know the ectomy part means surgical removal of. So this could be removal of all of the prostate gland or part of the prostate gland. So for example, commonly we do a transurethral resection of prostate, where the prostate gland is reamed out from the inside to reduce the obstruction caused by the prostatic enlargement. Pyro is the Greek word for fire. So a pyrexia is when someone has a high body temperature. They are hotter than we would expect them to be in health. Another word for pyrexia is fever. But then if we go the next day and take the patient's temperature again and the temperature's gone, then we would say they are now apyrexial. A means without a pyrexia. So hopefully at the moment you are apyrexial. You do not have a pyrexial body temperature. You do not have a fever. An antipyretic is a drug which will bring down body temperature when the patient has a pyrexia. So if we give paracetamol or aspirin or another non-steroidal anti-inflammatory drug, that will have an antipyretic effect. It will bring down body temperature. But it will only bring the body temperature back down to normal. So if someone's temperature is 39 and we give them paracetamol, that will bring the temperature down very often back down to 37. But if someone's temperature is 37 already, it won't bring it down lower than that, because it is preventing the fever mechanisms which are being generated in the hypothalamus. A Pyro Gen is something which will increase body temperature. So for example, a bacteria or a virus in the blood can act as a Pyro Gen. And also the bacterial or viral components in the blood will be recognised by the white blood cells, and the white blood cells will release pyrogens. And these pyrogens go to the hypothalamus to increase the body temperature. So the pyro means fire or heat, and gen of course means to begin. So the pyrogens will stimulate the development of a temperature. And usually that's a good thing, because the body works best, or the immune system of the body works best at pyrexial temperatures, and that will help to combat the infection. Tacky means abnormally fast. It's the converse of brady, if you remember from earlier on in this presentation. So tachycardia would be a fast heart rate. Tachypnea would be a fast respiratory rate.